even if you died of a clear alternate cause, but you had COVID at the same time, it's still listed as a COVID death. So everyone who's listed as a COVID death doesn't mean that that was the cause of the death, but they had COVID at the time of death.
It's worth remembering again that the ONS rates are people who've got COVID on their death certificate. It doesn't necessarily mean they were infected because many of them haven't been tested, so we just need to understand the difference.
15,796 people are currently in hospital with coronavirus. 21,678 have now sadly died in hospital.
The death toll from the coronavirus surpassing 50,000 people in the United States last week.
Technically, even if you died of a clear alternate cause, but you had COVID at the same time, it's still listed as a COVID death. So everyone who's listed as a COVID death doesn't mean that that was the cause of the death, but they had COVID at the time of death.
It's worth remembering again that the ONS rates are people who've got COVID on their death certificate. It doesn't necessarily mean they were infected because many of them haven't been tested. So
I think is critically important. Can you repeat what you just said, please?
Well, last Friday, I received a 7-page document that sort of told me that if I had an 86-year-old patient that had pneumonia but was never tested for COVID-19, but sometime after she came down with pneumonia, we learned that she had been exposed to her son who had no symptoms, but later on was identified with COVID-19, that it would be appropriate to diagnose on the death certificate COVID-19. Now, we've not done that. If someone has the pneumonia after, and it's in the middle of a flu epidemic, and I don't have a test on influenza, I don't diagnose influenza on the death certificate. I will say this elderly patient died of pneumonia.
I don't mean to interrupt you, but my heart is sinking right now as you're telling me this. You're a doctor. Why in the world would they be sending you out information to fill out death certificates, whether the person's been diagnosed with COVID-19 or not, but then to say in the death certificate this person's death was caused by COVID-19? That does not sound right to me.
I went to the person in our office who does most of the death certificates over the last 10, 20 years, and I said, does this sound right? I had her look at the documents that I'd printed off, and she said, well, we've always been told that you always put down just facts. You don't put down any probabilities. You don't put any presumptions down. It's just what you know. And so this is concerning. And it actually gets to your point, Chris. When we start talking about the data that goes into the modeling, we have to ask ourselves a question. Are we being forthright? Are we sharing with the public? Minnesota, North Dakota, we don't need to be having it sugar-coated. We want to know what's going into your modeling.
So with that being said, why would they want to skew the number of deaths due to COVID-19? Well,
fear is a great way to control people, and I worry about that. I worry that sometimes we're so darn interested in just jazzing up the fear factor.
Dr. Fauci was asked about the COVID death count today. Here's what he said in part.
What do you say to those folks who are making the claim without really any evidence that these deaths are being padded, that the number of COVID-19 deaths are being padded?
You will always have conspiracy theories when you have very challenging public health crises. They are nothing but distractions.
Conspiracy theories, doctor? So you're engaging in conspiracy theories. What do you say to Dr. Fauci tonight?
Well, I would remind him that anytime healthcare intersects with dollars, it gets awkward. Right now, Medicare has determined that if you have a COVID-19 admission to the hospital, you'll get paid $13,000. If that COVID-19 patient goes on a ventilator, you get $39,000, 3 times as much. Nobody can tell me after 35 years in the world of medicine that sometimes those kinds of things impact on what we do. Some physicians really have a bent towards public health, and they will put down influenza or whatever because that's their preference. I try to stay very specific, very precise. If I know I've got pneumonia, that's what's going on the death certificate. I'm not going to add stuff just because it's convenient. I think that it's not a conspiracy theory at all.
Yeah. So you reject what he said?
Absolutely.
Well, it's interesting that in Italy, where it's socialized medicine, I guess they don't have an interest in the money, if that's what it is here, and they just went back and they started reclassifying deaths according to their top scientific advisor. So they admitted that they were being liberal or generous in how they coded some of these deaths, and they're just going back and reclassifying them. Does that surprise you?
And that the ONS rates are people who got COVID on their death certificate. It doesn't necessarily mean they were infected because it doesn't necessarily mean they were infected because it doesn't necessarily mean they were infected because it doesn't necessarily mean they were infected because